So, thanks so much for having me here. Apologies in advance to everyone attending today. I am a little under the weather, but I'll do my best. I hope I don't lose my voice throughout the presentation. But yeah, so thanks for being here. As Gustavo mentioned, today this presentation will be focused on drivers of milk quality and with more like a practical view. I'm presenting a few studies and some cases that I've seen um, here in Michigan as working with extension. So, so sorry. Um, when we talk about, oh, let me see. Oops. Now it's working, right? Okay. So when we talk about milk quality, uh, we use this as a synonym of udder health, although it's a little bit beyond that. But for the sake of this presentation, if you hear me saying milk quality, udder health, or intramammary infections or mastitis, it's all going to be the same. Okay? So, um, mastitis, nothing new here. What is it? Is just an infection of the mammary gland uh, that is possible when pathogens, let me get my pointer, enter to the mammary gland throughout the teat canal and eventually get to the uh, secretory tissue, the tissue that produces the milk, and that's where they cause the infection. Most of the time, these infections are caused by bacteria. That's what we see most of the time. But we can sometimes see also yeast, algae, and after 2024, when we saw the H5N1 outbreak, of highly pathogenic bird flu and dairy cattle in the US. Now we also know that viruses, at least one virus, can cause mastitis too. And this infection causes an inflammatory response, and that's the etiology of this disease. Oops. Oh, and it is also the most common disease for our dairy cattle. On top of it, the most common disease is the most costly disease. It has been estimated that the losses due to mastitis are around $21 billion per year. And this is globally, not just the US or North America, but it has a huge economic impact in multiple nations. And clinical mastitis has also causes economic losses at multiple levels. So the main ones are culling due to culling and mortality, yield loss, discarded milk, but also labor, drug, diagnostic, and veterinary service are part of this economic losses. But the losses don't stop there. So there's can also depending on the country and the company or plant buying the milk, there can also be reductions or penalty or loss of premium. So just as an example, for a 1,000 cow farm that is producing an average of 90 pounds per cow per day, that means that that farm is producing 90,000 pounds per day. If that farm either opts for that premium or loses that a premium of 15 cents per hundredweight, that has an impact of around $4,000 per month. Not so much of a big deal for a 1,000 cow farm. However, if the premium is a little bit higher, let's say half a dollar, 50 cents per hundredweight, the story is a little bit different. Now we start considering a bigger economic impact that can be a premium or a reduction or a loss of a premium for a farm. And this is all based on bulk tank somatic cell counts, which is one of the most common metrics for milk quality. But it can also happen that mastitis can affect that milk marketability. So that's the ability to sell the milk from a farm. So depending on the co-op or the company buying the milk, they have different limits, upper limits that they will receive the milk from a producer. Usually, if there's a spike in bulk tank somatic cell counts, the producers get notified and actions need to be taken to reduce that those somatic cell. But if that problem doesn't get solved in time, that producer is risking not having a buyer for their milk because of the bad or problem with milk quality. So it has a very big economic impact. And I have been I've been asked from farms to help in this kind of issue. So where they're like in real trouble. So this is not an uh something that is doesn't happen anymore. It can happen and milk quality can change that fast. Now, nothing new, I think, here for most of the people attending today. But when we talk about mastitis and cows, we usually divide it in two. So clinical cases are is the case of when this disease presents with clinical signs that we can actually see. So these are changes in the milk, changes in the udder, the udder is more hard, is inflamed, is hot. The cow is showing us some behaviors of pain if we touch or palpate the udder. And we usually classify clinical mastitis as mild when there's only changes in milk, moderate when there's changes in milk and in the udder, and severe when on top of those two changes, there's also a systemic disease. So that's the uh, disease that we can see, that we can notice easily. However, the other type of presentation of mastitis, the subclinical, shows no sign. The cows appear normal like any other cow. The milk is normal, but that cow is actually dealing with an intramammary infection, and their somatic cell counts in individual somatic cell counts for the cows are above 200,000 per ml. And that's when that's where we draw the line to say that a cow is infected. So why do like this different presentation matter? If we are paying attention to clinical mastitis only, we see one picture. We see the cows that are showing us the disease. But if we consider also if we're tracking the subclinical cases, that can give us an idea of the real magnitude of the problem that sometimes can be, and in my experience, more often is the subclinical cases are more prevalent or have a higher incidence than the actual clinical cases. So having an idea of the subclinical cases and the clinical cases is the only way that we can have a whole picture of how mastitis is affecting our herd. So review this now old study about the impact of mastitis in early lactation. So this study was presented to me by my mentor. This is one of his favorite studies that he likes to cite. It was presented at the National Mastitis Council in 2015. And what these two researchers did is that they took data from 22 farms and over 164,000 cows. And they use DHI data, and that's for the people not from the US, that's the Dairy Hair Improvement Association, or the organization that puts together or gets summarizes all the individual somatic cell counts in the US. So what they did with this data is that they look at animals that didn't have clinical mastitis, uh, animals that, or any type of mastitis, animals that have clinical mastitis in the first 60 days in milk, and then animals, cows that had subclinical mastitis at first somatic cell count test. So their first, after calving, their first somatic cell count test was positive or was above 200,000. What they found here is that their milk production for both these groups was reduced. And very interesting here is that the production was greater for cows with subclinical mastitis at first test. Even the reduction was even greater than clinical mastitis in the first 60 days in milk. Both group of cows showed increased early culling risk. So they were more likely to leave the herd early in the lactation compared to cows that didn't have any type of mastitis, either subclinical or clinical. And both groups also had increased days open, so their fertility was also impacted. Additionally, the cows with high somatic cell counts at first test had an increased risk of clinical mastitis, so that's not surprising. So that impact of mastitis can be even more important if it presents early in the lactation of a cow, and it will impact, have a long impact throughout that lactation. Now, milk quality is, as many, many things in biology, multifactorial. So there's no silver bullet that fixes everything, and there's also a lot of things, a lot of factors that are interconnected. So I'm gonna try to cover not all of them, but try to group them in like broad categories. And first, the two big divisions are at a cow level. What drives milk quality? Number one here is, excuse me. Number one here is the overall health of the cow. So a healthy cow is the result of a calf that was fed a great colostrum program, a cow that has had good nutrition throughout her life, a cow that has had vaccination that prevented other diseases in her life. So all of that, all of those things contribute to a healthy or strong immune system, and that will allow the cows to fight intramammary infections better. That's because at the end, every intramammary infection in or clinical case or subclinical case is there's this interaction between the pathogens that enter the mammary gland and the response of the immune system of the cow. So that is one of the factors at a cow level. Another factor is parity. So I only have one, two, three, and three here, but that extent. So the older the cow, the higher the risk of exposure, or the more time those cows have been exposed to pathogens or had other diseases, maybe unrelated to mastitis, that impact their immune system. So this is another factor that also drives milk quality. Similarly, stage in the lactation curve, the more advanced in the lactation curve, the higher the risk of mastitis because of exposure in the environment, but also in the milking parlor. And lastly, the udder health. What's the state of that udder? it's gonna drive milk quality. How if a cow has never had an intramammary infection before, or how is the anatomy of that udder, all that can contribute at a cow level, and will drive milk quality for those animals. Now, a little bit different, but how do we what will drive or what will move our somatic our milk quality at a herd level? Number one, and I think with what I deal the most is housing and environment. So clean, dry, well ventilated housing is so important and critical to provide either a good or a bad environment or risk for the cows. So anything that is related to bedding or where the cows walk or where the cows are waiting in the holding pen, um, all that is very important at a herd level because it affects all the cows, not just a particular animal. Next is dry cow management. And we're gonna cover this in a little bit in a few slides. And lastly is milking procedures as well as milking equipment under the same image. So all this impact or drive milk quality at a herd level. So now we move on to the more fun part of the presentation. So what do we have here? This is what we want to see. Dry beds. Three examples of dry beds. And I know these pictures, two of them were taken right after the hallways were clean, but this is what we want to see. And we know that this doesn't last forever, but we need to clean those alleyways 2, 3 times to keep them like this as much as many hours as possible during a day. What else do we see here? Great. This free stalls look great. Good maintenance. Uh, all the edges of the free stalls were clean too. These are mattresses with a little bit of sawdust on top. So there's different beddings, but at the end, what it matters is that they're clean and they're dry. Two pictures here. I like this one on the left because I hope you can see it big enough to see that there is some manure in this milking parlor, okay? But it's not wet. And if you pay attention to the two cows udder that we see here, here and here, I don't know if you can see my pointer very well, but those cows udders, the udder hygiene score of those two animals, and I can tell you from for this farm, it's great. So this farms in particular doesn't do not clean the floor of the parlor after every line. They clean it maybe between groups, and that's enough because the rest of the farm is spotless. It's clean, and the cows are getting there clean. The cows are not stressed. They're not urinating. They're calm. So maybe this is not the cleanest parlor, but it works for this farm. So just a caveat there that you don't have to be cleaning all the time, but you can tweak things, or producers can tweak things to make the system work for them. And on the right, we have what I want to see in every farm, right? A cow that is laying down, a cow that is deep sleeping, that udder looks spotless, uh, cow comfort, cow well-being. There's no like great stocking density there. So that's what we want to see when we go to pens, walking pens. Moving on housing and environment, just a quick mention of manure solids. Um, I don't have the most experience with this. I know that in other states are a lot more popular with than what they are in Michigan. We have some here, but again, I am not an expert. What I do know is that it's risky, right? And the key here is to have to manage those beds as dry as possible and with the lowest count of bacteria. So, is it possible? Can we have good milk quality with manure solids? Yes. Is it tricky? Yes. Do you have less wiggle room? Yeah. Do you have to be more strict with your cleaning protocols, with everything? Yes. And now we have better technology that we have, like, I don't know, 5 years ago, that allow us to write the solids all very well. But that's the key. The management is a lot more intense than just recycle sand or virgin sand. Overstocking. So I just came back from my country. I'm originally from Chile. And when I go to some farms, I get reminded of the subway in my country. I'm not gonna put a one of those pictures in here. Um, but what do we know about overstocking? We know that is detrimental to the natural behavior of cows. We know that lying time is reduced as well as yield, but the role on milk quality is not clear. And I did a good job, in my opinion, looking for more in case I thought I was wrong. Uh, but I couldn't find any evidence. But what do we know about milk quality and overstocking without citing any study? We know that with increasing overstocking, with increasing stocking density, sorry, we're gonna have more manure. We're gonna have with more cows drinking water, more cows urinating, more cows defecating in the pen. So if we're gonna overstock, we're gonna have to step up our game cleaning those beds and cleaning those alleyway. And also heat stress can also uh, increase. Is not a given, right? And with this, with heat stress, this immune system can be impacted, and this thus reducing the way or impacting the way the immune system can respond to an intramural infection. So, in my experience, have I seen cow farms with too high of a stocking density in their pens with good milk quality? Yes, I have, but those farms are also maybe not like manure solids, but it's also risky. Things can get out of control easily, but also those are farms that have their uh environment, housing management. It's top notch. Despite that, overstocking is not recommended as a rule of thumb. Okay, don't I'm not endorsing it at all. So now moving on to dry cow therapy, or dry cow practices. This is the period that we have to cure uh, current infections and prevent of infections being acquired during the period when we're not milking the cows. So we know that blanket dry cow therapy works, and we also know that selective dry cow therapy works too, can work. But in order for selective dry cow therapy to work, we have to think of a few things. We need to meet some criteria. The most important part of that criteria is that we have data on the animals and that we always have to use teat sealant. And here I just want to show you a decision tree that was created by Dr. Pam Rook. Um, so this is just an example. This is if you or your clients are thinking about moving on to uh, or trying selective dry cow therapy, maybe this is something that you need to come up with your herd vet. But just an example, there's one level that we need to think about, like, is this for me? Is this for my farm? And that's your bulk tank somatic cell count. So first question, where are you with your bulk tank somatic cell count? And then you can move on to the next level. That is like, do you have what kind of data do you have for your farms, for your cows? Do you have monthly individual somatic cell counts and clinical mastitis records? Then you can move on and make a decision at a cow level. So then, uh, the cutoff is if those cows had uh, uh what oh my sorry, what are their somatic cell counts at the point of starting the dry period, and then if they meet that criteria, you can do a CMT test and then decide too. So different levels, a lot of decisions, a lot of information, a lot of management. This is just one flow chart or decision tree. You can modify it as you want. I actually done this for farms that modify this one. For farms that don't do individual DHIA or individual somatic cell counts, and they do CMT consistently. So it is possible, but it requires a lot of record keeping and a lot of decisions. Now, with current management system, it can be automated, so there's a lot of advantages in there. So yeah, if you're willing to try this, it's highly encouraging, and don't forget your internal teeth sealant. What is absolutely not recommended is stop using dry cow therapy. So I know that we have like an international audience today, but this is a trend that we're seeing in the US, at least in the Midwest. I cannot say for the entire country, and that is not using dry cow therapy at all, and based on no decision. There's no decisions made. There's just it's a blind or um a decision that affects all the cows, and I understand the why producers are doing this. There's no cost for drugs, and there's no risk of um sending milk antimicrobials entering the food supply. Um, but it's very risky and is absolutely not recommended. And this review that I cite here is from the Vet Clinics Food Animals of North America. It came out last year. It's a very, very good review. And there they cite this study that is from 2023. So what they did here is they look at mastitis in early lactation for one farms, but for two groups of cows. Cows that at dry cow therapy, a dry off receive antimicrobials plus internal teat sealants, and other group of cows that only receive the internal teat sealant. So that's the management that some farms are applying to all of their cows. So what did they see in these two groups? The group that received antimicrobials and internal teat sealants had a lower removal risk during the dry period, and uh, more show here in this graph. Here we have a survival curve that on the horizontal axis shows the days in milk of the cows, and here on the vertical axle shows the cumulative incident. So the blue, this color is the lower line is represents the cows with antimicrobials and internal sealants, and you can see that their cumulative incidence is a lot lower and is significantly lower than the cows that only receive internal teat sealant. So this group had a significantly lower mastitis risk through the in the first 200 days in milk. So very significant, and this is why, on top of many other studies, is that this is a very current study showing that we should not go that route. Lastly, on dry cow practices, no matter what we use, blanket or selective dry cow therapy, the way we apply or we provide the treatment is very, very important. And this is in my anecdotal evidence and my experience. Uh, Sometimes farms have great dry cow uh, therapy protocols. And when I ask the managers or the owners, they describe it, it's all good. But then I ask the people actually giving the treatment, and there's differences. So this is highly important because although we're doing this to protect the cows or cure them, if we don't do it right, we might be introducing a pathogen there and making more damage. So I invite you to revisit to check the NMC guidelines or this article that I wrote for Ports Dairyman. Now in milking procedures, let's they have to include the critical step, which is most of what we do during the milking procedures, and that will have an impact on milk quality, and also allow for the time and ensure that the milking technicians are compliant with the protocol. So sometimes we have the protocols, we ask the milking technicians to do it, but we do not let them. So those are things that we need to keep in mind. So now a few photos of what we want to see in milking procedures. Here we have great application of pre or post dip. And also on top of that, we need to provide the needed kill time or contact time with that solution and the skin. If not, it's a waste of product. Stripping the teats has two objectives. We're also stimulating the cow, but we're also discarding the milk, and we can check for clinical mastitis. If we don't do this step, we are missing every mild case of clinical mastitis, and those cows are the milk from those cows is going straight into the bulk tank. So milk and equipment real quick, adequate sittings and properly maintained. I'm not going to go more deep into this, but it is also very important for maintaining milk quality. So now let's think what happened when we have a milk quality emergency. Let's pretend there's an increase in bulk tank somatic cell counts and a farm just lost their SEC premium. Now what? What do we do? The first thing that I recommend farms to do is do not make any changes. If we make changes too quick, we need to figure out what is causing this first and then do strategic changes. So the next step in addition to not making any changes to the management is to collect data. So that's what we're going to do. So for the farm background, we can ask what changes did they do? Did they buy new animals, change products, added any new technology, changes in the diet, turnover rate of the milking technicians? All that could be an easy answer, but most of the times I don't experience that. Well, that's not the answer. Bulk tank somatic cell counts and bulk tank cultures are not enough. They're not telling us the entire story. So we have to dig deeper. And this is where we can ask what's the state of clinical mastitis? Are they being detected? How are they being detected? Are we capturing those mild cases? Are they being recorded? Is the incidence increase or the same? What cows are being affected? Early lactation, late lactation, what parity? All that information we need to learn from clinical mastitis. And also individual for clinical mastitis. do we have individual cell counts? Are they getting done on a monthly basis? If they're not being done on a monthly basis, they're not very valuable for milk quality, other than knowing what cows are high and what cows are not. But we cannot track new infection rates or chronic subclinical infections. So, are they increase? Are they the same? What cows are seeing the increase? What cows are being impacted with subclinical mastitis? All that information we should collect from this clinical and subclinical mastitis. Now, with milk cultures, we need to do some strategic sampling based on the information that we gathered before, and then we can figure out what type of pathogen. So, real quick, if you we see a lot of contaminated cultures or samples that are a waste of money, and most importantly, when there's an emergency, they're a waste of time. So if you're not sure, or if your farm is struggling with a lot of contaminated data, I invite you to check this video. It's 60 seconds and easy way to learn or correct what's going on with your sampling techniques. Now it's time for boots on the ground. What are we gonna do? We have all those data that we collected. Next, I would recommend a parlor assessment when we observe and check and evaluate the milking procedures and the milking time tests, as well observing teats, post-milking changes, teat skin condition, what's the hyperkeratosis incidence in the herd. I'm sorry. In the others, other hygiene scores is my best friend, and I'll talk a little bit more about that later. And in pens and alleyways, observe cleanliness, heat straight abatement if they're working or not, um if they should be being used and they're not, and how what's the state of the stalls. So, simple thing that we need to observe in a milking routine: if cows are supposed to be prepped from left to right, make sure that they're not doing zigzag, because the simple deviation of the protocol or protocol drift can have a big impact. The kill time is not the same, and that's going to be the main thing. And there's also going to be more opportunity for recontamination after post dip and wipe off for some cows and not others. In addition to what the potential issues with milk letdown. This happened in the same farm. Long parlor, two milking technicians, one doing an amazing job, the other one needed to improve. So under the same parlor, same tool, same everything, same rhythm of working, we can have variations like this. So one is a good, one needs improvement. Here on the left is my favorite picture of what not to do. This is it's a post dip on a farm, and is a simple waste of product. And on the right, we have another farm with this other farm wasn't as bad as farm A, but they also have a lot of room for improvement with their pre and post dip application techniques. But one big difference between farm A and B is that the other hygiene score of farm A is quite different from farm B. So that gives this farm B, a little advantage, even though they're both failing at the post-it coverage. Farm B might be able to get away with murder a little bit more than Farm A. And now I told you already a little bit about the Otter Hygiene's scoring chart. So this is a simple, super useful tool, very easy to monitor in your farms, and it gives us a lot of information. So the goal here is goal for sampling at numbers is to sample at least 30 animals per group, at least 80 cows total. And it sounds like a lot, but I'll give you my secret of how I do it, because it's very, very easy. The goal that we want to have is to have cows less than 20% of the cows that we check, and this score 3 or 4, where more than 10% of the surface area is covered in manure or soil. So we want most of our cows with 1 and 2, and like less than 1/5 of the cows in this 2 score. So these are maybe not the best light. This is the reality of milking parlors. So here we have cows with 1, left to right, score 2, score 3, score 4, and I think it's very obvious to assume that these two ladies on the right are at higher risk of mastitis. And what I do to evaluate a lot of cows this is that when I'm doing a parlor assessment, I'm doing 5 things at the same time. But as soon as the cows walk in the line to get to their milking stalls, I grab my phone, I have a speech to text, and I start with group number 3, and I look and I dictate to my phone. So that way, in less than 60 seconds or less than 15, I can walk from one end to the next and score 25 cows in 15 seconds very easily. So it's a thing that you have to train your eyes, and then you can use technology to capture that data and have a good sample size. And this, I encourage farms to use it to monitor constantly, not just um, not just when there's issues. You can score different for seasons, for shifts, different groups. This is a very good tool, super easy to use, and very useful, at least for me. What type of things do I see when I get asked to go to help farms to solve milk quality issue? Something like this. This pen hasn't been cleaned yet, but you can see that this is going to be an issue, as well as in here, there's again this poor maintenance of the pens that impacts milk quality. And maybe the beds are in great condition, but just because of this, that accumulation of manure there is not going to be good for milk quality. And a favorite, because if there's a chance the cows are going to do this. So is why maintenance of the stalls is so important. And I think these are my last 2 pictures to show. Uh, this is an example of when cow comfort is not good for milk quality. So this was in a hot summer day. Cows, I can tell you that cows were very content in there, but this is a milk quality disaster. So udder hygiene score were awful for this pen, and this is something that is not acceptable at all, even though cow comfort was great that day. So, a few management that we can do to better milk quality, and I don't want to. It's very easy for me to say what you should do. But I've been in your shoes. I've managed. I've been employed by a farm. I've been a worker. I've been a manager. So I know it's hard, but maybe one of you can find one of those things that you can apply. So I don't want to sound like everything is so easy, but I understand that it's very hard. So. Number one that I would do is to evaluate the udder hygiene score. If you're reaching the goal of less than 20% between 3 and 4, keep up the good work. If not yet, try to look for opportunities. What can you do that is easy fix, low effort, maybe low cost, that will get you there? Then be proactive and not reactive. And this is how I try my philosophy, but it really pays off when it comes to milk quality. So we need to know where we are, and like if we use metrics for stuff, right? So for milk quality, we can use metrics. And ideally beyond the bulk tank somatic cell count. So if you're not doing it already, I highly encourage you to invest in individual somatic cell testing. Uh, you don't have to do it for the entire year. Even if you do it for 4 months in a row, that will give you enough information to calculate new infection rates, chronics, and also evaluate how your dry period is doing. And also be aware of the risk of some changes. So now we have a lot of options available for so many things, automation, products. So if you're gonna make a change in your farm, just be aware of what can go wrong. So if things go wrong, you're prepared. So be proactive in that way too. Now, not lastly, revisit your milking procedures, see what's working and what's not working, and if you find an opportunity there, also try to just try it, right? If farms, this is your experiment. If you can experiment at your farm or at your client's farm to improve milk quality, if they let you, please do. And one thing that we're also I'm very passionate about this. Farms going away from forced stripping. If you're not doing it now and you see that this is an opportunity to uh, improve milk quality, reincorporate forced stripping, even if it's a few milkings a week, one time a day, but that can have a big impact in your milk quality. Lastly, now for sure, invest in your team. New employee training, retraining, monitor and communicate your goals and how they're doing. Give feedback to your employees, to your team, and look for other opportunities for development. I think a lot of people would be surprised of how willing people are, or how eager are employees to learn beyond their job responsibilities. And just this is the last study that I'm going to cite from Dr. Zamar Rodriguez from MSU. So he and his colleague look at how training on farms staff can impact milk quality. So on 16 farms, they train 112 employees. And after training, they saw an increase in the predicted contact time, which is good. It's desired, right? A decrease in poor post-it coverage, again, another good outcome of the trainings, an increase in clinical mastitis detection that, at least in my experience, that is also something that farms struggle a lot because they're doing things so fast or they don't know how to detect clinical mastitis. So this is also a positive thing that came out of the training. It's not that the clinical mastitis incidence went up. And also, these farms were struggling with increasing bulking somatic cell count, and that trend stopped after the training. So all good things came out of this training sessions. And although I don't have any data, I can also tell you that in my experience, there's only positive things as results of training employees. So I'm just gonna skip this and leave you with if you want to look at more information about how or ideas, inspiration of how to improve your milk quality, your farm milk quality, or your clients, I encourage you to look at the resources that NMC, the Global Milk Quality Organization, has available. These ones are free to download. You can go here and look for this. And this is a very detailed document that has been updated just last year. And with that, whew, I'm done. Right, 5 minutes late. Sorry.